And we also offer you notes with CBME-based question and answers, MCQs. And there's also a fun zone where you can do your self-assessment as well as enjoy it. And we have these MCQs from beginner level to expert level. So they are standard multiple choice questions, which are asked in most of the university exams of all the states. We have the subscription plans, three plans, basic, standard, and mentorship. Mentorship is a wholesome subscription plan, which we are giving at a special rate of 50K. So here we give you pre-recorded classes, live doubt clarification, as well as one-to-one personalized guidance and notes and quick revision of the examination module. You can use the code Dr. Divya 20 for discount on the subscription. You can also book a slot for personalized counseling session using the code. And about internal exam marathon series. So it's these series are for about 45 days duration, where we are doing the rapid revision of all the important questions, as well as about the volatile facts. Then we also multiple choice questions will be covered. And all this will help you to get good grades in your exams. So this is beneficial for everyone. So all the university exams of all the states, you can use the code Dr. Divya 20 for the first free live class. So now we begin with the Thorax Marathon series. So here, so today's objectives are, we will be discussing on the right atrial development, intraventricular septum development, external features of heart, internal features, blood supply, nerve supply of the heart, and arch of aorta. So coming to the first question, right atrial development. So usually this question is asked as a 5 marks question, so as a short essay question. So how do you write this answer? So you need to write always in embryology, when the development happens, what is the source, okay, which are the embryological structures which form this, as well as the stages in the development. Then if there are any remnants of the embryonic structure, as well as anomalies associated with the development. So the heart is the initial organ to develop, which develops from the cardiogenic area. So coming to the initially, the heart tube is, the entire heart is a tube, okay, which will divide into different areas or dilatations. So we have this entire heart tube here. So this is if you view this section, this is like a sagittal section which we are seeing, okay. So this is the primitive ventricular chamber. This is the primitive atrial chamber. So initially the entire heart is like a big chamber, so which will later divide to form the 4 chambers. So we are concentrating on how the primitive atrium or the atrium is formed. So the first step here is, so since it is a single chambered heart, now the first thing will be to separate the atrium from the ventricle. So from the tube, this is the heart tube. So from the walls, that is the dorsal wall and the ventral wall, 2 cushions will develop. That is known as the AV cushions or atrioventricular cushions. Okay, so these 2 cushions will develop. Okay, so when if we take a coronal section like this, it looks like this now. Okay, so this is the AV cushion which has developed, otherwise called as the AV septum also. Okay, so this is the first step in the formation of primitive atrium. So once this is formed, it divides the single heart into two chambers. That is, above will be the atrial chambers, below will be the ventricular chambers. So this will be the right atrioventricular canal, this will be the left atrioventricular canal. So once this is formed, the next step will be to separate the right and the left atrium. So for that, what happens is, from the roof of the atrial chambers, a septum develops downwards. Okay, so there is a septum which develops downwards towards the AV cushion. So that is the second step. So as the septum is developing downwards, there will be a small gap between the right atrium and the left atrium here. So that gap is called as the foramen primum. Next will be this septum primum will fuse. Okay, the septum primum will go towards the AV cushion, and then it will fuse with the AV cushion. So when it is fusing with the AV cushion, what happens is it separates from the roof here. So that is the third step. Okay, so the fusion of the septum primum and separation from the roof. So here this gap, now we call it as the foramen secundum. So with the formation of foramen secundum, okay, so the next step will be the formation of septum secundum. Now this septum secundum also, it develops from the roof and grows towards the downwards towards the septum primum. So this gap between the foramen, the septum primum and the septum secundum here, this we call it as the foramen ovale. So till birth, this foramen ovale remains patent, from which the right blood from the right heart, okay, right atrium basically will be shunted to the left atrium. So this is the fourth step, okay. So this is the formation. So what happens after birth? Okay, soon after the pulmonary circulation is established. Okay, so when the pulmonary circulation is established, what happens? What do we mean by pulmonary circulation, Durga? What happens there? Soon after birth, as the fetus is born, okay, the newborn is born and it takes the first breath, the pulmonary circulation is established. So what happens there? So basically, the blood goes to the lungs and from the lungs, it comes back to the left atrium. So when the blood comes to the left atrium, the left atrial pressure will become more. So because of that, what happens is this septum primum will oppose with the septum secundum. Okay, so both the septums will oppose each other. And the physiological closure happens first. Okay, anatomical closure of this foramen ovale happens after 3 months after birth. Okay, so physiological closure, that means any blood, okay, no more blood from this right atrium will shunt to the left atrium. That is what happens there. Okay, with the physiological closure. Later, these two septums fuse and anatomical closure takes place. So this is about the formation of the atrial chambers. So now, interatrial septum and the atrium. So here now, atrial septal defect. So what are the septal defects now? So first is septum primum defect, where it remains patent there. Okay, septum secundum defect and persistent foramen ovale. Okay, so foramen ovale remains patent. That is known as the atrioseptal defect. Then premature closure of foramen ovale. Okay, so these are some of the defects we see. So you can list it out when you write about the anomalous. Okay. Another one is the common atrial chamber. There what happens is the septum primum itself doesn't develop and it remains as a common chamber. So both the oxygenated and deoxygenated blood gets mixed up there. Okay. So these are the things which you need to write. Okay. So when we talk about the atrial development, okay, when we talk about the atrium development, so what are we going to write? First step will be the formation of AV cushion. Okay, second will be the formation of septum primum. Okay, and then will be the formation of septum secundum. Okay, septum secundum. So the complete formation of interatrial septum will only happen after birth. Means this foramen ovale will close only after birth. Okay, interatrial septum will. Okay, so this septum, the physiological closure of this foramen ovale is the first to happen soon after birth. Okay, so physiological closure happens after birth, soon after birth, whereas the anatomical closure happens. Okay, so anatomical closure happens 3 months after birth. Okay, 3 months after birth. So this is very important. So that is why initially, sometimes even in an ultrasound of a newborn, there will be some shunting, small appearance of that foramen ovale. Okay, so that should not be mistaken for atrial septal defect. We should see if there is any shunting because physiological closure has happened. So no blood will be shunting from the right side to the left side. Okay, so you look for that. And if it is okay, then you just give them assurance. So you check it after 3 months. So by that time, the complete closure would have happened. Okay, anatomical closure. So that is how you write the answer under these things. So this foramen ovale, the remnants of this foramen ovale, what will we see? Remnants when we talk about. Okay, so remnants when we talk about, you should say the foramen ovale will form the fossa ovalis. Okay, fossa ovalis is the remnant. Another one is the limbus fossa ovalis. So fossa ovalis is the septum primum part. Okay, and limbus fossa ovalis will be the septum. Fossa ovalis will be, okay, the septum secundum part. Okay, so these are the remnants which we will see after the development. So these are the things you should mention. Next question is interventricular septal development. Okay, so interventricular septal development is between the right and left ventricles. So here, okay, again the same things we go, the time, source, stages, remnants, and anomalies. Okay, so here if we see, this interventricular septum has got 3 parts, the bulbar part, the membranous part, and the muscular part. Okay, so 3 parts are there. So all these 3 parts have different source of development, and later they all fuse together to form a single the interventricular septum, okay, dividing the right and left ventricle. So now, how does it develop? So now coming to the stages or the steps of development, okay. So first thing will be, now this is a which section? This, when we see the section, this is like a sagittal section which we have taken. Okay. Now this is the common ventricular chamber. Okay. So the first thing to develop here, okay, will be now, this is the primitive ventricle. Primitive ventricle, well, this is the truncus arteriosus part. Okay. This is the primitive, this is the bulbar part and truncus arteriosus part. So this near in the bulbar part of the primitive heart tube, this one, here 2 ridges will be formed. That is the right and left bulbar ridges are formed. Okay. So now the first thing will be, what happens is, there is development of the muscular part. So from the floor of this primitive ventricle, a septum develops. Okay. Muscular septum. Okay. So here the proliferation of these mesenchymal cells which form the muscle part will form here. This we call it as the muscular part. Okay. So a median muscular ridge will grow upwards from the primitive ventricular floor. Okay. So this will reach almost up to, this is the AV cushion which is formed, okay, separating the atrium and the ventricles. So it will reach up to these AV cushions. So this portion forms the muscular part of the interventricular septum. Okay. So next thing to develop is the bulbar part. Second part is the bulbar part. Bulbar part develops from these 2 ridges. So I told you there are 2 ridges, right and left bulbar ridges. So these bulbar ridges will proliferate and they form the bulbar part of the interventricular septum. Now there is a gap here. This gap is called as the IV foramen. So initially the blood will be shunting from the right side to the left side. So this will be filled by the membranous part. Okay. So if this doesn't get filled up like by the membranous part, if the membranous part doesn't have develop here, it results in what we call it as the ventricular septal defect. Okay, so the next thing to form will be the membranous part. Now this membranous part will develop between this bulbar part and the muscular part. Okay, so how does it develop? This membranous part is developed from 3 sources. Okay, so one is from the right and left bulbar ridges as well as from the right AV cushion. Okay, so 3 from here, that is the right and left bulbar ridges as well as from the right AV cushion, the cells will migrate and they form the membranous part. Okay, so with the formation of the membranous part, the IV foramen is closed. So no, and the interventricular septum is completed. Okay, so one of the common developmental anomaly which we see commonly is the tetralogy of Fallot. This is very commonly asked, and it also forms part of 3 mark question, or it can be asked as an MCQ. Okay, so all the following are the components of tetralogy of phalate, except, or which is the feature of tetralogy of phalate. So like that, any MCQs can be asked. Okay, so tetralogy of phalate, it includes 4 things. One is there is pulmonary stenosis. Okay, so there is pulmonary stenosis means this valve, okay, between the pulmonary trunk, where it begins. So here this valve, there is stenosis. So blood is not going from this ventricle to the pulmonary trunk. So pulmonary stenosis is there. So when there is pulmonary stenosis, blood is not going. Okay, blood is getting collected in the ventricle itself. So what happens? The ventricle hypertrophies. Okay, so there is right ventricular hypertrophy. So because of this, what happens? This ventricle chamber is becoming big. So this aorta gets shifted. Ascending aorta gets shifted this side. Okay, this is moving this way because of the enlargement. So it gets shifted. That is called as the overriding of aorta. Okay. And the 4th defect we will see is the ventricular septal defect. So usually ventricular septal defect is associated with tetralogy of phalate or pentalogy of phalate. Pentalogy will be along with ventricular septal defect, there will be atrial septal defect also. Okay, so this is one thing which you should remember. Okay, so these are the things which we write for ventricular development. So ventricular that is interventricular chamber. Interventricular septum, no? Okay, so you have to know interventricular septum. So what are the things? It has 3 parts. The muscular part, then we have the bulbar part. Okay, the second to develop, and third to develop will be the membranous part. So Durga, from where does the muscular part develop? Can you tell me? You need to participate in the live class, okay? So that I will know whether you are understanding. So muscular part will develop from the floor of the primitive ventricle. Bulbar part will develop from the bulbar ridges, okay? Right and left bulbar ridges. Membranous part will develop from bulbar ridges as well as the right AV cushion. Okay, so these are the important things which you should know. So these are the source for the development. Okay, right. So these are the headings which you should remember, under what you need to write the answer. The third question, coming to external features of the heart. Okay, so external features of the heart, we talk about the borders, surfaces, chambers, any appendages, grooves and sulcus, and any vessels on the outside which are related to it. Okay, right. So here the heart has got grooves and sulcus. When we say it is the grooves which are present between the atrial and the ventricular chambers, or between 2 atrial chambers, or between 2 ventricular chambers. So in the front we have this atrioventricular groove, that is between the right atrium and the right ventricle, and anterior interventricular groove, that is between the 2 ventricles, and here left atrioventricular groove, that is between the left atrium and the left ventricle. Okay, so this groove or sulcus, it can be called both. Okay, groove or sulcus it is called. Right. And posteriorly we have the posterior interventricular sulcus. Okay, and this is the atrioventricular posterior. Okay, on the left side and on the right side. And here we will have the posterior interatrial groove or the sulcus. So all of this, that is interatrial groove, then interventricular groove, posterior interventricular groove, and the atrioventricular groove will meet at a common place. And that is known as the crust of the heart. Okay, so this is very important. Crust of the heart. This point is known as the crust of the heart, where all the grooves, interatrial, interventricular, and atrioventricular grooves will meet. Okay, so coming to the heart. So heart as an apex. Okay, so this is the apex of the heart, and this portion is known as the base of the heart. So usually when we hold the heart in the anatomical position, this base should rest on a palm. Okay. So this is the apex. So it has four surfaces. The right surface, which is otherwise called right pulmonary because it will be in relation to the lung. Okay, right surface. The inferior surface, which is otherwise called as the diaphragmatic surface. The left pulmonary surface of the left surface of the heart. Then this is the anterior surface. Okay, behind that will be the base and this will be the apex. So these are the surfaces. So coming to the borders here, okay. So it will have a right border, the inferior border or the inferior margin here, and the left border here, left border of the heart, and this will be the superior border of the heart, okay. So these are the borders of the heart. So usually in these groove and sulcus, now in the anterior, now this is the right atrioventricular groove, we have the right coronary artery passing. Okay, between the interventricular groove, we have the left anterior descending artery, which is a branch of the left coronary artery. It will be running through that groove. Okay, and in the left atrioventricular groove here anterior, we have the circumflex artery, which is again a branch of the left coronary artery will be running. Okay, and posteriorly, okay, in the posterior interventricular groove here, we will have the posterior interventricular artery vessels. Okay, so artery will be running there. And in the atrioventricular groove, we will see the coronary sinus. So one of the important structure, coronary sinus, we will see, as well as we will also see the circumflex artery on the left side and the right coronary artery on the right side. We will see in the atrioventricular groove near the base. Okay. So here, so all these grooves you need to mention, the groove and the sulcus, and what are the structures present there. Next, when you will talk about how many surfaces and how many borders are there. Okay. So already I told you that. Okay, the surfaces and the borders there. Okay, and the apex of the heart. Apex of the heart is situated in the left fifth intercostal space. Okay, it is present just below the nipple. In a lean person, we can actually say it is present below and to the left of the and to the right of the left nipple. Okay. Right. So here the right border of the heart, if you see, it is entirely formed by the right atrium. Okay. The inferior border of the heart is formed by the ventricles. The left border of the heart is completely formed by the left ventricle. Okay. So you should remember that. And there are these projections here, this one and this one. They are known as the auricles, the right auricle and the left auricle. They are the common site for the formation of thrombus. Okay, so clinical anatomy, heart can be dextro, that is like, dextrocardia we say. So usually we see it towards the left side, but here you are seeing it towards the right side. So usually it is a part of a condition known as situs inversus, where the organs are mal-rotated, like in the sense, the right side will be on the left side will be on the right side. So basically it is like a mirror image which will be present. Okay, so these are the things. So when we talk about the external surfaces, external features of the heart, external features. So what are we going to talk about here? So first thing is we need to write about its presenting parts. Okay, presenting parts, which includes borders and surfaces. Okay, borders and surfaces. So borders, when we say it has got how many borders, Durga? Okay, it has got how many borders? You need to tell me, right? Border, left border, inferior border, and superior. Okay, and surfaces also, it has 4 surfaces. Okay, and we have an apex and a base. Okay, so that will be the presenting parts. Then you write about the grooves or the sulci, which are present there. Okay, so this you will say. Next is the internal features. So internal features, we study the internal features of the right atrium and internal features of the left atrium. Okay. So when we talk about internal features of the heart, okay, so we write about, as I said, features, then the features seen in atrial and interventricular septum, then right and left atrioventricular orifices we write about, okay. So first is coming to features of the right atrium. So this is the right atrium. So if you see right atrium has got an anterior wall and this will be the posterior wall, okay. So posterior wall is smooth, anterior wall is rough, okay. Anterior wall is rough because of the presence of what we call it as musculae pectinate or pectinate muscles. Pectinate muscles are there, so that is why it is rough, anterior wall. Posterior wall is smooth, and the junction of posterior wall and the anterior wall here, okay, this we call it as the say crista terminalis, okay, crista terminalis. On the outside, we call it as sulcus. That is the junction of anterior wall and the posterior wall of the right atrium. Inside, we call it as the, what is that? Crista terminalis, okay. So what are the features we see in the posterior wall? Posterior wall shows the opening of three main structures and smaller veins. So superior vena cava opening, inferior vena cava opening here, and coronary sinus opening. So superior vena cava opening doesn't have any valves. Inferior vena cava opening is guarded by a valve which is called as the eustachian valve, and coronary sinus, which is guarded by one more valve that is known as the Thebesian valve. There are semilunar valves which will be guarding the inferior vena cava and the coronary sinus. So these are the features we see in the posterior wall of the right atrium. In addition to that, there are small openings which we call it as the foramina venae minimarum. Foramina venae minimarum. Foramina is foramens, venae minimarum. That is small. Venae is veins and minimarum is small. So the small veins open on its surface. So that is openings are present. Then we go to the interatrial septum. So interatrial septum, what features we see? One is already I told, when we discussed about the atrial development, we have the fossa ovalis. This is the fossa ovalis or oval fossa. So this is the remnant of septum. Which one, Durga? It is septum primum. This is the septum primum. And this is the limbus fossa ovalis. Limbus fossa ovalis is septum secundum. Then another thing is we see here a triangular area which is known as the triangle of Koch, which is bounded above by the tendon of Todaro. This side it is bounded by the coronary sinus. Okay. And inferiorly it is guarded by this tricuspid valve, septal leaflet of the tricuspid valve. So this area forms the triangle of Koch. And why triangle of Koch is important is because the AV node is situated there. Okay. And just above this triangle of Koch, there will be a bulging. It is a bulging produced by the non-coronary aortic sinus, which is known as the torus aorticus. That bulge is known as torus aorticus. So these are the features we see it in the interatrial septum. Okay, coming to the ventricles. So in the ventricles, okay, so ventricle, between the atrial and the ventricular chamber, we have the tricuspid valve, where there are three leaflets, anterior, posterior, and the septal leaflet. Okay, three leaflets are there, which are like, scalloping. It shows scalloping. One end is attached to a collagenous ring here, which is present at the atrioventricular orifice. And these valves show scalloping. And to this scalloping ends, okay, to the margins, the chordae tendineae are attached. Okay. So here, this interior of the right ventricle will show two areas. One is the rough inflow part and a smooth outflow part. Okay. So this is the outlet, which is smooth, whereas this is the inlet, which is rough. Okay. And it is rough so as to regulate the flow of blood. When it is, when you, we put water on a very smooth surface, it moves very fast, right? But if there is a rough surface, okay, rough surface, things move little slowly on the rough surface. Okay, very irregular surface, it moves a little slowly. So that is why, to control that, because from the atrium, when the blood comes here, it has to regulate that flow because the pressure has to be maintained. Okay, so for that purpose, it is rough. Whereas from the ventricle, the blood has to go into the pulmonary trunk. So it has to go pump against the gravity, right? So this area will be smooth. Okay, so as for the easy flow. So outlet is smooth. So in this rough part, we see features. What are the features we see? We see the chordae tendineae. We see papillary muscles. Okay, we see the chordae tendineae. These are the papillary muscles. And then we see the trabeculae carneae. So these trabeculae carneae will be of three kinds: bridges, ridges, and papillary muscles. Okay. So this is what I said by papillary muscles, and this one is the chordae tendineae. So here in the chordae tendineae, we have true chordae tendineae and the false chordae tendineae. Okay, so true chordae tendineae means it should attach the apex of the papillary muscle to the cusps, that is the leaflets, okay, to the valves of the atrioventricular orifice, or that is right or left. Okay, both will have the similar features. Only thing is, here we have three leaflets, tricuspid. In left side, there are two leaflets, which is called as the mitral valve. Okay, so here, when from the apex of the papillary muscle, when these chordae tendineae are attached to these leaflets, we call them as the true chordae tendineae. Okay, and some chordae tendineae, okay, they will go, they are attached to the different parts here, and they go in different directions. They are not attached exactly to this margin of this leaflets. Okay, so those are known as the false chordae tendineae if they arise from any other part other than the apex. Okay, so here we see this bridges, ridges, and trabeculae. So as the name says, bridges, what happens is only two ends are attached, and middle it will be free. And among them, the important one is this moderator band, through which runs the right bundle of His. Okay, so it helps in the control of pressure there and the flow of blood. So that is why it is called as the moderator band. Okay. So these are the things on the interior of the ventricle. So outflow part here, if you see, this is of the ascending aorta here now. Okay, so left ventricle also will show the similar features. So when it is going out, so we see the three cusps. Which three cusps we see? So here we have an anterior and two posterior. Okay, right and left posterior. Okay, so here, if you see these cusps, they are like a cup. So what happens is they provide a vortex. Okay, so when the blood flows to the ascending aorta or through the pulmonary trunk, okay, so the blood should not flow back, right? So what happens is the blood gets filled in this, and it helps in the approximation of the cusps, and so that the cusps don't open. So that is why, you know, for this ascending aorta and near the pulmonary trunk, we have, instead of like leaflets, here we have like this cusps, okay, which will be present there between the ventricular chambers and the pulmonary trunk or ascending aorta. But in the ascending aorta, in these three cusps, we see the opening. Okay, this is the coronary openings. Okay, coronary sinus, coronary openings, or we call this as the aortic sinus or coronary sinus of the aorta. So this is for the right coronary artery, and this is for the left coronary artery. Okay, so right coronary artery comes from the anterior aortic sinus, whereas the left coronary artery comes from the left posterior aortic sinus. Okay. So these are the leaflets you can see. This is in the living, how we will see. Okay, so these are the things which you should write. Okay, so when we write about the features of the atrial chamber, features of the ventricular chamber. Okay, so when we summarize, okay, so atrial chamber, atrium, you will write about the two walls. Okay, two walls, anterior and posterior. Okay, so anterior will be rough, and you should write why it is rough, because of the presence of musculae pectinata. Posterior is smooth, okay, and it shows the opening of three things: superior vena cava, then inferior vena cava and coronary sinus and smaller veins. Okay, venae, caudae, minimum. So these two are guarded by valves. Okay, then you also talk about the interatrial septum. So what features you will see? So there you will see fossa ovalis, then you see limbus fossa ovalis, then you see triangle of Koch. Okay, then you see tendon of Todaro, you see, and then we also see which one? Torus aorticus. Okay, so this much things you should need to write. For the ventricle, you will write about the inflow part and the outflow. Inflow and outflow. Okay, so inflow part will be rough again. So in the inflow part, what are the things you will see? You have to write about the chordae, tendinae. Then you will write about the trabeculae carne, which will show bridges, ridges, and papillary muscles. Okay, and you have to explain about it. So these are the things which you should remember. Next, coming to the blood supply of the heart. So blood supply of the heart, otherwise called as the coronary circulation. So whenever I say blood supply, it includes both the arterial supply as well as venous drainage. So arterial supply is by the coronary arteries, right and left coronary arteries. Venous drainage is mainly by the coronary sinus. Okay, so right coronary and left coronary artery, they arise from the aortic sinuses, which I already showed you. There are two small openings here. So this is the aortic sinus. Okay, okay, so here see, this is the right coronary artery. This is the left coronary coming. Okay, so this is the anterior one. These are two posterior ones. So posterior, right and left. So from left, it comes here. Okay. So this is here no coronary arteries will arise. So this bulging only produces the torus aorticus in the right atrial chamber. Okay, so from the right coronary sinus, no, this one, here we have the opening. Okay, this is the anterior aortic sinus from which begins the right coronary artery. Okay, and from the left posterior, we have the left coronary artery beginning. Okay, so these are the sinuses. They are also otherwise called as the sinus of Valsalva. Right. So now, once it begins from here, so you can see this is the sinus. The right coronary artery runs between the pulmonary trunk, okay, and the right auricle. It runs in the atrioventricular groove. Okay. Then it reaches the inferior margin, winds around the inferior margin, and passes between the posteriorly between the atrioventricular groove. Okay, it passes, reaches the crust where it will anastomose with the left circumflex artery. So in 60% of the people, it ends at this by anastomosing with the left circumflex. Okay, in 20%, it ends at the inferior margin itself. In other 20%, it ends between this crust and the inferior margin. And in some 10%, okay, it will, it will just go in the posterior interventricular groove. So these are the different terminations of the right coronary artery, but commonly it is at the crust. The left coronary artery, if you see, it begins from the left posterior aortic sinus, passes between the pulmonary trunk and the left auricle. Okay, and immediately divides into two branches, that is the left circumflex and the left anterior descending. The left anterior descending runs in the anterior interventricular groove and it will end up here. Okay, winds around the inferior margin, runs in the posterior interventricular groove where it will anastomose with the posterior interventricular artery, that is a branch of the right coronary. Okay, and left circumflex will pass around the atrioventricular groove and then posteriorly also in the atrioventricular groove and ends in the crust by anastomosing with this. So these with the right coronary. So that is the course of the artery. So whenever you write, you will write about the where it begins, where it ends, the termination, the course of it, and the branches. So the right coronary artery will give mainly atrial branches, ventricular branches. In the ventricular branches, the right coronary artery near the infundibulum. This is the pulmonary trunk. Okay, so there it winds around. So it will anastomose with a similar branch from the left coronary, that is from the left anterior, this one, descending. Okay, so it will anastomose, and that is known as the annulus of Wiesens. Okay, it is known as annulus of Wiesens. Okay, so you should know that. That is basically the anastomosis with the right conus and the left conus. Then it gives many ventricular rami, and the largest is the right marginal artery. Okay, it gives atrial branches, and among the atrial branches, the important one is the sinoatrial nodal artery, which supplies the SCA node. And posteriorly, it will give the posterior atrial and ventricular branches, as well as, yeah, it will also give this posterior interventricular branch. Okay, posterior interventricular branch will also give the septal branches, which supplies the posterior inferior, 1/3 of the posterior inferior part of the interventricular septum. Okay, so this posterior interventricular branch. So depending upon whether this posterior interventricular branch is coming from the right coronary or from the left circumflex, we call it as coronary dominance. Coronary dominance. If it comes from the right coronary dominance. If it comes from the circumflex branch of the left coronary, we call it as left coronary dominance. Okay. So this is the branches of the right coronary. So left coronary, I told you, it gives two branches. That is the anterior descending or left anterior descending, we say, otherwise also called as the anterior interventricular. So this will give ventricular branches, and it will give one more artery which passes diagonally. That is known as the diagonal branch. Is not coming from me. Actually, diagonal will come from the interventricular. Okay. So that is one of the branches of it. And it also supplies the septum, interventricular septum, that is the anterior 2/3. Then there is the circumflex branch. Circumflex branch, you remember, the left circumflex will give branches. To remember those branches, remember the Riemannic slab. Okay, so it will give sinoatrial nodal artery. So SCA nodal artery usually comes from the right coronary, but this also can give the branch sinoatrial nodal artery. Then it will give the left marginal, okay, which will pass along the margin here, left margin. Then it gives an atrial branch, okay, which is known as Kugel's artery. And sometimes it may give posterior interventricular artery. Okay, so that is how you will remember for the circumflex artery branches. So basically the commonly involved, so usually there is fat deposition, which we, okay, and there is narrowing of the blood vessels, which we call it as atherosclerosis. So atherosclerosis will lead to ischemia of the heart and myocardial infarction. So commonly affected vessel is the left anterior descending artery. The next common will be the right coronary, and then will be the circumflex. So these are the in the order of blockage. Okay. So usually if there is a blockage, we do a bypass surgery, right? So venous drainage of the heart. Venous drainage is by the coronary sinus. Now coronary sinus will begin, okay, will begin here at this junction. Okay, so here you can see this is the beginning of the coronary sinus. So coronary sinus begins here, okay, in the left atrioventricular groove, winds around the left margin of the heart and goes to the posterior atrioventricular groove. So here it is joined, at its origin, it is joined by the great cardiac vein and the left marginal vein. Okay, so this left marginal vein here and the great cardiac vein will join here, open into the coronary sinus. So this coronary sinus will run here Okay, and it runs in the posterior. Excuse me. Okay. Posterior atrioventricular groove, and it opens in the this. Okay, it opens in the posterior wall of the right atrium. Okay, through the coronary sinus opening. So here it is joined now by the different veins. So one is that I told you already, great cardiac vein as well as the left marginal vein will join. So great cardiac vein will be draining the anterior part of the heart. Then we have the middle cardiac vein. In the posterior interventricular groove, we'll have the middle cardiac vein, then the small cardiac vein here, okay, then oblique vein of the left atrium, and the posterior vein of the left ventricle. Okay, so great cardiac vein, middle cardiac vein, small cardiac vein, oblique vein of left atrium, and posterior vein of left ventricle. So these are the tributaries of the coronary sinus. Okay, so like this, you can just show the diagram showing the tributaries. Okay, so these are the things which you should write. So right coronary artery, what are its branches? Left coronary artery, the origin. So any artery or anything when you write, always remember artery, you should write under the following headings: origin, then the termination where it ends. Okay, termination, then about its course, then branches. Vein, when you write about the vein, you should write as again origin, where it ends or drains into, it is termination, its course, and here we don't say branches, we say tributaries. Okay, coming to the short answers, the nerve supply of the heart. Okay, so nerve supply of the heart, when we talk about, okay, so it has both sympathetic and the parasympathetic. Okay, so the sympathetic nerve supply and the parasympathetic nerve supply. So parasympathetic nerves are derived from the vagus nerve. Okay, and they are basically cardio inhibitory. Okay, parasympathetic is cardio inhibitory. So what do? Their stimulation, it causes the slowing of the heart rate. Okay, so there is, with the parasympathetic stimulation, there is slowing of the heart rate and there is constriction. Okay, and the sympathetic fibers are derived from the upper 3 to 5 thoracic spinal nerves. Okay, so thoracic spinal segments, it is derived. So they are cardio-axillary. So their stimulation, it will increase the heart rate and it will cause the dilatation of the coronary arteries. So basically, it has a opposite action of that of the parasympathetic. Now these nerves, they form a plexus. There are two types of plexus superficial and deep cardiac plexus. Okay, so you have to write what are the nerves contributing to the formation, where it is located, and what are the nerves contributing to its formation. Now the superficial cardiac plexus here, it lies, if you see here, it lies below the arch of aorta in front of the bifurcation of the pulmonary trunk. This is the pulmonary trunk, so bifurcation here it lies. Okay, just to the right of this is the ligamentum arteriosum. To the right of the ligamentum arteriosum, it rises. Okay, so this is formed by the superior branch. So if you see here, it is formed by the superior cervical cardiac branch of the sympathetic trunk. Okay, branch of the left cervical sympathetic trunk. So this is the left cervical sympathetic. So from the superior cervical cardiac branch of left sympathetic, as well as inferior cervical cardiac branch of the left vagus nerve. So they join to form the superficial cardiac plexus. So this superficial cardiac plexus will supply it will give the branch to deep cardiac plexus. It will give branches to the right coronary artery and left anterior pulmonary plexus. Okay, so that is the superficial. Now the deep cardiac plexus, okay, here you see, the deep cardiac plexus lies in front of the bifurcation of the trachea. So behind the arch of aorta, okay. So here you can see both. So this is formed by all the cardiac branches from the 3 cervical and upper 4 or 5. So all the 3 cervical, upper 4 or 5 thoracic ganglia, the sympathetic chain. Excuse me. Okay. And is as well as all the cardiac branches of the vagus and the recurrent laryngeal nerve, except for the inferior cervical cardiac branch, because that participated in the formation of superficial cardiac plexus. So distribution of this, it will supply the corresponding, because we have the right and left, right? So left halves of this deep cardiac plexus. So it will supply the right and left coronary arteries respectively, as well as the pulmonary plexus. And it also gives separate branch to each of the atria. Okay, so that is about the deep cardiac plexus. So next, the last question is arch of aorta. So how do we write where it originates, where it terminates, and its branches? So the arch of aorta begins as a continuation of the ascending aorta, okay, where the ascending aorta ends. So that is, it ends at the sternal angle. So there begins the ascending aorta, and ascending aorta continues, it forms like a loop and continues as the descending aorta again at the left end of the sternal angle. Okay, so that is its so this is the ascending aorta, this is the arch of aorta, and this is the descending aorta. So the arch of aorta gives 3 branches: the left subclavian, the left common carotid, and the innominate artery, which we otherwise called as the brachiocephalic trunk, which further gives the right subclavian and the right common carotid artery. Okay, so basically supplies the upper limbs. So these branches of these supply the upper limb as well as the head and neck region. Okay, so so with this we finish the class. So thank you for watching Auricle. You can download the app. You can get it on Google Play or App Store. And you can also follow the contents on the following social media handles, like we have on YouTube, Instagram, Facebook, and Telegram. Okay, so till we meet next, see you. Bye. Good night.